Hi, my name is Daisy Ignacio. I'm going to be your nurse for today. I'm going to go ahead and start by washing my hands, and I'm going to provide some privacy for us. Okay, may I go ahead and verify your name and birthday, please?
Yeah, my name is Alexander Velasquez. My birthday is 3/13/96.
Okay, perfect. And are you allergic to any medications?
No, no medications.
Okay, perfect. So today we're going to be doing a cardiovascular system exam. So I'm going to start by assessing your jugular venous pressure. So go ahead and turn your head to the left. Okay, perfect. I'm going to use my pen light. Okay. We're trying to look for any pulsations. Okay, great. Okay. So there is no distension in the jugular vein. Now we're going to go ahead and take your carotid pulse. I'm going to start with this side first. Okay, and we're going to go ahead and take this side now. Okay, perfect. So pulse is strong, regular, and 2+ bilaterally. Now I'm going to go ahead and take a listen to your carotid pulse. I'm going to start by using the bell. Okay, go ahead and breathe normally for a few seconds. And now hold your breath. Very good. Okay, and I'm going to use my diaphragm. Okay, and go ahead and breathe normally for a few seconds. And hold your breath. Okay. Very good. Okay. So there are no carotid bruits detected. Now I'm going to go ahead and inspect your ventricular pulsations. Just go ahead and lay down. Okay, great. So there are no signs of bounding, heaves, or lifts, and the apical pulse is not visible. So now I'm going to go ahead and palpate. So I'm going to start at the right sternal border, which is the aortic. Okay. Go to the left sternal border, which is pulmonic. Okay. I'm going to go down to the tricuspid. And to the midclavicular line, which is the mitral. Okay, great. So skin is warm and intact with no signs of thrills, heaves, or lifts. Now I'm going to go ahead and take a listen. Okay, so I'm going to start with my diaphragm. Okay, I'm going to start at the aortic. And pulmonic. And tricuspid. And mitral. Okay, now I'm going to go ahead and use my bell. At the aortic. And pulmonic. And tricuspid. And mitral. So rate and rhythm are regular and consistent. There are no murmurs and distinct S and 1S2 sounds. Okay, so now I'm going to go ahead and inspect your peripheral vascular system. So I'm going to start by inspecting your upper body. I'm going to take a look at your arms. Okay, I'm going to check for skin recoil. Okay, perfect. And can you take your fingers and go like this for me, please?
Yes.
Okay, just go ahead and lower these a little bit more. There we go. Okay, perfect. Thank you. And I'm going to go ahead and check your capillary refill. Okay, great. Okay, so upper body is normal in color. There are no signs of cyanosis, pallor, or jaundice. no signs of clubbing in nails, capillary refill is less than 2 seconds, and there's normal skin recoil, meaning there are no signs of dehydration. So I'm going to go ahead and check your pulse now for your brachial one first. So go ahead and put your arms a little bit. Thank you. Okay, great. I'm going to check your radial. Okay, perfect. So pulse is symmetrical, strong, and 2+. Now I'm going to go ahead and inspect your lower body. So I'm going to go ahead and check your skin color. Very good. I'm going to go ahead and check for skin recoil. Okay, perfect on both sides. Okay, good. And I'm also going to check capillary refill. Okay, great. So no signs of pitting edema or swelling. There are skin tone is even with no cyanosis, pallor, or jaundice. There are no signs of varicose veins and skin is warm. Skin recoil is normal with no signs of dehydration and capillary refill is less than 2 seconds. Now I'm going to go ahead and check your pulse in your lower extremities. I'm going to start with popliteal. Okay, there it is. Go ahead and try this one. Okay, great. I'm going to check your posterior tibial pulse. Okay, then we're going to check your dorsalis pedis pulse. Perfect. And now we are going to check the femoral pulse. Great. So all of the pulses are symmetrical, strong, and 2+.